Which of the following bodily fluids does not transmit human immunodeficiency virus, HIV? A. Breast milk. B. Blood. C. Vaginal secretions. D. Semen. E. Saliva. The answer is E. Saliva. HIV is easily spread through all of the listed body fluids with the exception of saliva. A person may not contract HIV through exchange of saliva during activities such as kissing or sharing eating utensils. Which of the following regarding human immunodeficiency virus, HIV, is false? A. The risk of transmission increases in individuals who have another sexually transmitted infection such as genital herpes. B. In heterosexual encounters, it may be easier for a woman to contract HIV. C. The number of disease particles in a fluid is called the viral load. D. HIV can spread to other individuals starting 2 weeks after the host is infected. E. Healthcare workers have a relatively low risk of contracting HIV when using standard precautions. The answer is D. HIV can spread to other individuals starting 2 weeks after the host is infected. HIV may be contagious just days after the host is infected. Women in heterosexual relationships may become infected more easily than men due to prolonged exposure to bodily fluids. It is, however, possible for men to contract HIV from an infected woman. HIV is not frequently transmitted to healthcare professionals. Even for those who suffer from needle stick injuries, transmission is unlikely. Symptoms of acute human immunodeficiency virus, HIV, typically occur within how long after infection? A. 8 to 12 weeks. B. 1 to 2 weeks. C. 4 to 8 weeks. D. Greater than 1 year. E. 2 to 4 weeks. The answer is E. 2 to 4 weeks. Symptoms of acute HIV generally occur 2 to 4 weeks after infection. A vast array of symptoms may be present such as fever, rash, generalized fatigue, nausea, vomiting, diarrhea, and a sore throat. The nurse prepares to insert a peripheral venous catheter, PVC. Which of the following is an incorrect step in this process? A. Secure catheter with tape. B. Assess for infiltration or hematoma. C. Hold skin taut to stabilize vein. D. Explain procedure to patient and confirm identity. E. Insert catheter bevel down at a 15-degree angle. The answer is E. Insert catheter bevel down at a 15-degree angle. The catheter needle must be inserted bevel up at an angle between 10 to 30 degrees. The correct steps for inserting a peripheral venous catheter, PVC, are 1. Explain procedure and check identity. 2. Prepare equipment at the bedside on clean surface. 3. Apply appropriate personal protective equipment as needed. 4. Distend veins by applying tourniquet 4 to 6 inches above site. 5. Clean site with facility-approved cleaning solution. 6. Hold skin taut to stabilize vein. 7. Insert catheter bevel up at an angle between 10 and 30 degrees. 8. Pierce skin and vessel to enter vein. 9. Advance catheter until blood return observed, then remove tourniquet. 10. Withdraw needle from catheter and advance catheter to hub. 11. Secure catheter with tape or facility-approved dressing. 12. Attach forward tubing and begin infusion. 13. Assess for complications including infiltration or hematoma. The surgical nurse cares for a patient status post-umbilical herniorrhaphy. Which of the following nursing interventions is a priority for the nurse? A. Avoid coughing. B. Preventing overexertion. C. Relieve urinary retention. D. Provide ice packs. E. Turn and deep breathe. The answer is E. Avoid coughing. All of these are important nursing interventions for a post-op herniorrhaphy patient. The priority is to prevent increasing intra-abdominal pressure. Relieving urinary retention and avoiding coughing are the most important considerations to achieve this priority, but it is most important for the nurse to remember to avoid coughing, as it is most likely to increase intra-abdominal pressure. It is also important to remember because it is often promoted for other post-operative procedures, and this is one case where it is not.